Hi, I'm Dr. Wallace at Catawba Heights Animal Hospital. We get a lot of questions this time of year about fleas and ticks since we're in the South and see them all the time. I'm going to talk to you today about fleas and ticks to kind of give you a better understanding, and my assistant here is going to ask me some questions.
Dr. Wallace, how does my dog get fleas and ticks?
So in the South, well, anywhere in the U.S. too, you get fleas and ticks simply by going outside, and it doesn't mean that the animal has to go outside. The human can go outside too, go work out in the grass, the garden, mow the yard. The fleas can hop on your clothing and ticks, and then you come inside and they hop off of you, and then they find their way to your pet. So anything that goes outside has the potential to get fleas and ticks and bring them inside.
So they can spread from my dog to my home and my family too?
Yes, once they come inside your home, they will find anything that is warm. So fleas like certain humidities, temperatures, and vibration. They will seek out humans and any kind of mammal. So not just dogs and cats. They also will, rodents, guinea pigs are some, chinchillas are some others, rabbits, and they will go to them. They will bite, get a blood meal. They will lay their eggs. The eggs are very slippery. They will fall off into the environment where they will turn into the pupa stage, which is a very hardy stage, and they can stay in that pupa stage for several years at times. And then once the right humidity, vibration, and temperature arises, so say like a dog walks by or you walk by, it will cause them to hatch, and then they'll hatch, they'll grow up, and then jump on the next thing that comes along and bite for a blood meal and reproduce that way.
So what health problems can fleas and ticks cause my dog?
They can cause several problems. In adult dogs, they're more of a nuisance. They do transmit intestinal parasites, tapeworms. So the flea has the tapeworm inside their belly. When the dog licks and grooms or the cat licks and grooms, they swallow the flea is digested, the tapeworm eggs are released, and then about 21 days later, after swallowing the flea, you will see these little grains of white rice on your pet's rectum, rear end area. Those are tapeworm segments. In kittens or dogs, small animals, too many fleas can cause an anemia because they suck blood. So you can have flea bite anemia when you have a severe infestation, and it can cause death to a very small animal because they have a very low blood volume compared to a large animal. And I have seen pets pass away from flea anemia due to such a high amount of fleas on them.
How effective are flea and tick medications, and what's the difference between over-the-counter and prescription flea and tick?
So, flea and tick medication, there are two general categories. There's EPA products and FDA products. EPA products are going to be topical that are absorbed into the skin. They don't enter the system. Those are going to be flea and tick only topical products such as Frontline, Advantage Multi, or not Advantage Multi, Advantix. FDA products are products that are taken orally or a topical product that contains heartworm prevention. So a topical product would be Advantage Multi and Revolution. Oral products are going to be Bravecto for dogs. There is Credelio tablets once a month. Topical is Revolution as well, and the Advantage Multi. And they work by getting into the system, into the blood, so when the flea bites, they suck the blood up. The blood has medicine in it, and the medicine kills them, and they have a lasting effect. They last for 30 days. So unlike flea dips that we did back in the day, they have what we call a residual effect. They last for 30 days, or some products like Bravecto last for 3 months. So when you do a flea dip, as soon as the dog's dry, you have no flea medication on the dog. With the topical or the orals, they can last a certain period of time in their blood system, so you don't have to do something daily.
And is there a collar I can put on my dog for fleas and ticks?
So most collars aren't very effective. The only collar we generally recommend is the Seresto collar by Bayer. It's a collar that fits on the neck. It lasts 8 months for fleas and ticks. And it has to be placed just right and be kind of tight against the neck to get that good skin contact. All your other flea collars don't do a whole heck of a lot, as the flea has to come into contact with the collar, and they're usually on the neck, whereas most of the time the fleas are going to be found right at the base of the tail or the underside of the pet between the back legs. That's where they like to hide a lot. So a lot of times flea collars are not effective.
What will my veterinarian recommend for flea and tick treatment?
Most veterinarians are going to recommend a product that has an insect growth regulator, an IGR, meaning it gets the babies as well as the adults. It's an adulticide and kills the babies and has a lasting effect. So most are going to recommend a product that lasts 30 days or 90 days. Most are now leaning towards an oral, because the orals you cannot wash off or bathe off like the topicals. The topicals you have to be very careful when you apply it, before and after a bath, and what shampoo products you're using to wash your pet. If you're washing them with anything that has a detergent in it, or a shampoo that can strip it off, so flea and tick shampoos, Dawn dishwashing detergent, those are degreasers, and they pull the grease off the pet. The topicals sit in the grease glands of the skin, so you're pulling that product off, you're stripping that product off. So you have to be very careful. You have to use a non-soap shampoo that your veterinarian recommends to bathe them with.
How can I identify fleas and ticks on my dog, and what should I do if I see those?
So fleas look like they're very small, tiny, and they can jump. They jump around a lot. They'll also leave a black, crusty, tiny substance all over the body. That's flea dirt, we like to call it. It's basically dried up flea poop. If you moisten it, it will be red. Ticks are much larger. They have a bunch of legs. You're going to see them attached to the skin. In our area, we do see ticks that carry disease. We see Ehrlichia. We can also see anaplasma, and one thing we're seeing more and more of is Lyme disease. In 2019, North Carolina became a Lyme state. It is very prominent in the northern part of the state, especially the mountains, but we are seeing it more and more in our area. In fact, we just saw one earlier today diagnosed with Lyme, and it has not been out of our area. If you have any questions about fleas or ticks, please give us a call. We have various products that we sell for our patients, depending on their need and what the client wants, the owner wants, doesn't want, how they can get it in their pets. Some pets do better with topical because they won't take a pill, and some pets do better with a pill because they're swimming all the time. But give us a call, 704-827-0616.